In a hyper-digital world, tech is empowering consumer engagement with healthcare. How is the ultimate global community platform participating? Well, we get to find out now. I'd like to welcome Freddie Abnousi and Jenny Streets to the stage.
Thank you. So hi there, I'm Jenny Streets. I lead the health team at Facebook in Global Marketing Solutions. We work with marketers across health to tell their stories on our platform. But I'm most excited today to introduce Dr. Freddie Abnousi, who is the head of healthcare research at Facebook. Give me a second, it's going to take me a minute to get through why he's qualified to talk to you today. So he's the head of healthcare research at Facebook and a practicing interventional cardiologist. Also serves as innovation advisor to the American College of Cardiology, professor adjunct at Stanford University School of Medicine, and assistant professor adjunct at Yale University School of Medicine. Previously led innovative healthcare efforts at companies such as McKinsey and Google, and has served as founder and CMO of Core Dynamics Incorporated, an interventional heart failure company. He completed fellowships in cardiovascular medicine and interventional cardiology, as well as residency in internal med at Stanford University. He was previously a resident surgeon at the University of California, San Francisco, completed his MD at Stanford University, MBA from Oxford University, and a Master's of Science in Health Policy Planning and Financing from the London School of Economics. So, I know, this is why mine was very brief. Can't compete with that. So tell me, and he's also just delightful to work with, and you're going to hear a lot about that now. So it's really odd, I think, for people to find out that someone like you with your background is working at Facebook. Can you tell us a little bit about how you got into medicine and more specifically what brought you to Facebook 3 years ago?
Absolutely. The long and short of it is that it's about impact. And as an interventional cardiologist, I have dedicated my professional development and professional career to really trying to improve the health of our community. And we do that in a very deep, individual, and meaningful way. So let me share with you what that means. So let's go back to New Year's Eve when I was last on call, and it was around 4 a.m. And I got a call from the ER with a pretty panicked ER doc who was taking care of a person in the ER who was really, really ill. And they'd come in with a pretty dramatic heart attack. And so in the next 4 or 5 minutes, we exchanged a bunch of data, information, EKGs, and so forth. And it was very clear that he was having a very severe heart attack. And then the bat sign went out. We activated the staff for the operating room. And within 30 minutes, we're at the hospital, diagnosed the patient accurately into the operating room where we got access to his coronaries, identified the lesion that was causing the problem, and changed the trajectory of his life. He was on the brink of death, and within about 40 more minutes, he was in a safe place now. Now, of course, the next couple of days matter in that type of heart attack, but he's in a much better place then than he was when he started. So you can imagine this type of work is incredibly meaningful and profound for that individual, his family, the team, myself personally. But one of the things, if you're interested in public health, you realize fairly quickly is regardless of the number of stents you put in coronaries for acute heart attacks, though meaningful to the individual, are really difficult to move the needle for the public's health, which gets us fundamentally to what are the drivers of health outcomes in America, and where should we be focused? Should we be really trying to put more hospitals and clinics on every corner to try and increase access and quality of care, which is what I've dedicated my life to and most people in the hospital have as well? And it turns out there's really 4 major drivers of health outcomes in America. One is exposures, like exposures to bad things such as asbestos. If you get exposed to it in a significant way, you don't do as well as someone who hasn't. The second is access to quality health care. Of course it matters, and this gentleman who showed up in my operating room on New Year's Eve wouldn't have made it if it wasn't the case. Third is genetics. We know that genetic predispositions lead to impacts on health outcomes as well. And the fourth are social and behavioral variables, these so-called social determinants of health that we've heard so much about in the last couple of years, but the research on them goes back a few decades, 7 to be exact. It turns out that we've all, I'm sure, actually thought about all of these things when it comes to you, me, our families, our friends, our communities, and trying to improve our own outcomes. But we probably haven't put them in list form, and we probably haven't added weights to them. And the part of this which makes it an existential crisis, and the reason why someone like me ends up at a place like Facebook, is the weighting. So it turns out exposures account for about 5% of outcomes in America. 10% comes from healthcare access and healthcare quality. 30% comes from genetics, and 55%, the lion's share of health outcomes in America, are driven by these social determinants of health. So if we improve access and quality, it's incredibly important. It's going to be very difficult to move the needle for the public's health. And with that in mind, we have to start thinking about other approaches to improving our outcomes across America, which aren't doing that great at this point.
So what's interesting there, I'm curious to hear a little bit more about, is so you get an opportunity to go to Facebook, and from your perspective, it's essentially this ability to go broad and have a broader impact, especially considering what you just discussed.
Yeah.
But if you take your experience in the field, what would you say, considering what you just said, are the most salient health challenges today? Is it what you just talked about in terms of access, or is it something else?
So let's set the stage with some statistics. I think it's always important to do that.
You always like to share.
Yeah. In terms of our outcomes in America, we have some of the best clinical care, and we take care of sick people incredibly well, but we do a really poor job in preventing them from getting ill in the first place. So if you compare our mortality prematurely compared to every other developed nation, year on year, persistently and consistently, the US ends up having some of the worst premature mortality across every major measure, such as premature mortality, maternal mortality, and so forth, every year. And then if you look within the United States from sea to shining sea, we have an incredible discrepancy that also exists. So if you're lucky enough to live in certain counties in California and Colorado, you're expected to live till you're 85. And if you live in certain counties in Mississippi, you're expected to die at 65. And that's a 20-year discrepancy as you go from sea to shining sea. And I think the interesting thing to remember is social and behavior variables are actually the drivers for these outcomes. And so if you're to invest in improving this inequity in health outcomes, you're to invest in improving this persistent and consistent lack of preventative outcomes, preventive-driven outcomes, you have to really understand the social and behavioral variables, and you have to really invest in sort of making that your use case.
And so how does technology have impact on these things?
So this is funny from a Facebook employee, but technology doesn't matter. The only thing that matters is outcomes. And whatever the technology is that drives that, then that's the technology that works. And so I think this gets us to should you build a widget and search for a purpose, or should you find a purpose and build your widget?
Exactly.
And I think that the latter always makes more sense. To me, it does.
Yeah, I think, so I'm going to come back to that because I think there's something there that we should talk to. But before we get there, I'm curious if there's a specific innovation when it comes to these things that you're most excited about.
Yeah, over the last few years, if you're paying a lot of attention to how healthcare is going in America, there's 3 trends that I think are super exciting, which ultimately I think when they come together lead to improved outcomes potentially. One is this concept of aligning incentives for reimbursement for health outcomes, value-based care, if you will. Mm-hmm. The second is designing around the human as opposed to the healthcare system, right? And those are the 2 vectors that if you can point them in the same direction, you can almost feel like they're going to overcome some of the health outcomes challenges we have. And the third is technologies that enable either one or 2. So when those things come together, you end up in a situation where if you're designing medicines, you may not have to have the most high-tech new medicine to make an impact, but it should be designed to deliver that medicine in a way that makes sense for that individual in a personalized way.
Yeah, it's funny because one of the things that to me is a similarity with tech is user design or user-based or user-centered design, and the idea around health and the opportunity that health has similarly. But anyway, I'm curious when one of the other things that we've talked about is the work that we're actually doing at Facebook. And so when you, as the head of healthcare research, tell us a little bit about the work that's being done and the impact that we're having.
So broadly speaking, what part of the mission of Facebook is to really try to improve the health of our communities through our technology and through our network and our community. And I think this is the other vector that I should have mentioned earlier, but it's very important to know. There are groups out there that are investing in community health workers, and that's showing real impact on health outcomes. And I think the concept of really tapping the community to improve an outcome for a person is really interesting to think about as well. So that said, a very specific thing we're doing is using our infrastructure and technology to try and enable the things that people are coming to Facebook for anyway. An example of that is some of the preventive health work that we've done.
So the preventive, I think we're gonna show that. Can we show the preventative health?
Is it up? I guess.
I can't see. Oh, yes, it is. So tell us a little bit about what this tool is, when it launched, why we've launched it.
Yeah, again, let's set the table with some statistics. So if you think about health outcomes in America, and you just think about last year, and the number one and number two causes of death in America were heart disease and cancer. So in sum, we had about 1.3 million lives lost last year just to heart disease and cancer alone. And that's a devastating number, but it's even more devastating when you consider that a significant portion of those lives lost are completely preventable. And preventable not through some really high-tech new scan or technology that is only available in certain markets, et cetera, but preventable through some fairly standard bread and butter technologies, essentially clinical care, that has been established over decades of evidence generation, gathering, and assessment, and lives in a sort of clinical guideline world of expert organizations. So for cardiovascular disease, that tends to be American College of Cardiology, American Heart Association, American Cancer Society for Cancer, and so forth. And so the question is, if this pretty standard clinical care exists and should be available for everyone across the country, why is it that hundreds of thousands of people are not getting it? Right? Why is preventive care not happening, even though it's pretty straightforward for the most part? It turns out education and access are really important. And that we can do pretty well at Facebook. So what we've done in this preventive health tool is to try and bridge the gap between our communities and our consumers with the expert bodies that hold this clinical wisdom. And so we've tapped and partnered with these organizations, taken their clinical guidelines, made them more digestible, and something you can use on your phone, and put it into pockets of every consumer that is on our platform. And so everybody here, if you get a chance, please check it out on your mobile app on Facebook. If you just search preventive health, it'll come up. And what we do here is actually do, I think, what Facebook does best, which is allow expert organizations, in this case for cardiovascular disease and cancer, to directly take their guideline-driven, evidence-based information and give access to it to our users directly. The goal here is that people will engage with that information, become their own health advocates and advocates of their friends, families, and communities. And as such, start that conversation with their primary care physician to see what is the right care for them. They're more informed when they walk in, which we know is one of the barriers to getting preventive care to start.
So health is super personal. And I think one of the things, I have a couple of questions in this area. So what was the approach that you took, understanding that I think people have, when they're on Facebook, it feels very public. And so what was your approach to developing the tool with that consideration in mind? And then my follow-up is on that. What was some of the hardest challenges as you were building it?
Yeah, fair point. So our approach generally was experts give expert information, Facebook does not. And so that was the first thing, which is partnering with these amazing organizations that have spent decades generating and assessing this incredible evidence base. The second thing was that we are really there just to connect these two groups, which is the experts and our users, and we have to do it in a user-friendly way that is engaging and people want to use. And then the third thing is we wanted to make it really privacy first, so that there's very little impetus, there's very little barrier to getting into the tool and using the tool. So the way we did this by partnering with great organizations, making the tool really simple, and as everybody can tell if they're on the tool, it actually is a pretty simple tool. And then finally, building a space where you can engage with this information that is free from advertising. And so it allows it to be a very safe space for people to go to.
And then what was the biggest challenge building it?
I'd say the challenge in building this was really taking this immense amount of clinical information, which I'm used to, and making it something that every person that my father would want to use.
Right.
And I think getting that right, and I'm not sure we got it right, but we're definitely on the way there, and we'll change it over time as well. But I think that's a really important thing. And the question is like, is it engaging enough for people to really, not need somebody else to go to talk to in order for them to engage with the information?
So tell us a little bit about what it launched with and then what the plans are for where it's going.
So we launched with the number 1 and number 2 causes of death in America, which are cardiovascular disease and cancer. And since we launched in the middle of flu season, we also incorporated our partnership with the CDC for flu guidelines as well. And so that's where we're starting. We're really trying to approach this in a way where we're learning from it and doing what's right for folks over time. So we're going to spend the next 6 months or so really learning how people are engaging with it so that we can improve it. And ultimately, the goal is to prevent disease here.
So that was bringing me to my next question. Tell me a little bit about how you see success, both in the short term and the long term for the tool.
Success here, without question, is if we can make a dent in some of those table statistics we talked about earlier. There's a 20-year life expectancy discrepancy across the country. And to be frank, it's just not okay. And if we can make even the smallest dent in that, I would be incredibly happy with that success.
Awesome. So I want to shift gears a little bit. There's a lot of folks in the room, some of which work for really big companies, some work for small companies, and I want to start first with startups. So what advice, after having done this, do you have for small startups in health that are trying to get their product into market, or that are perhaps they see a friction that they want to bring a solution to better the healthcare experience? What advice do you have for them?
So I'd say 2 things. One is you have to focus on outcomes, right? Now, outcomes can be different, but they have to be solving that problem. One of my teachers in medical school used to say, Tylenol doesn't improve my life expectancy, but it makes me feel better. So that's an okay outcome as well. So it doesn't necessarily have to be mortality related, but you have to be solving a problem that's health related in that case. And then secondly, I think health actually is very different than everything else we do, and approaching it with the humility that is required, and then secondly, approaching it with the clinical and scientific evidence base that ensures safety first and then efficacy thereafter, and generating that evidence base so that people want to use that product in a peer-reviewed academic way, if you will, or in a regulatory approval type way is really important.
A little bit more on that. So I'm curious, so Facebook is a big company that at one point was a startup. Sometimes I call it the biggest small company that I've ever worked for. But when you think about that in the context of a big company, I think a lot of companies that aren't necessarily tech, but see opportunities to build tech to either better the healthcare experience or consumer experience, do you have any different advice that you would give to folks who are working in perhaps a different type of company, but looking into launching something in the tech space that would solve a problem or something along the lines that you just described?
So your question specifically more along the lines of
big company.
A big company. Boy, I will tell you, one of the things I've learned at a big company is, even though it's a very small big company, is that alignment across stakeholders in existing markets is actually a challenging proposition, especially if you're looking at innovative spaces, which not only have reward associated with them, in this case health outcomes improvements, but significant risk as well. And so I think the magic that is moving large programs forward in big companies is a skill set that I'm still working on.
I think it's a skill set we all are working on. So I want to ask you a little bit about the future of healthcare. So we're sitting at CES. A lot of this sometimes feels like the future. It's 2020, also feels like the future. But when you think about where we are and where we can go, tools like the ones that you've created and where you want to get them to, what are you most excited about? What do you see as the biggest opportunities? And then I want to follow on with what do you think that the biggest challenges are?
So if I thought everything was going well in healthcare, I would have stayed full-time in healthcare. And it's not, right? Again, the statistics, our outcomes generally are not good compared to the rest of the developing world. We have a massive discrepancy in outcomes as well. And so the question is, how can we solve that? I ultimately think the 3 vectors that are most important is that you're solving a problem that's outcomes related. You are focusing on in an area where the misaligned incentives in healthcare, fee-for-service and otherwise, are now aligned. And then finally, you're designing for the human and what they need. Let me give you an example of how this sort of maps out. I assume there's some folks in the audience that are comfortable and familiar with the barbershop study that came out of New England Journal of Medicine maybe a year ago now. So please bear with me. I'm going to give you a few of the details. In America, one of the things we have a really tough time with is African American male hypertension. In fact, it's a public health emergency. We do a terrible job in treating African American men who have hypertension. They have the highest related mortality compared to any other group. This study that was done, and it was out of Southern California, asked the question whether trust perhaps was important in that decision making, as opposed to inventing a new medicine that targeted X, Y, or Z. And so what they did is they took bread and butter medicines and randomized 52 different barbershops, because they had a gestalt that at these barbershops there was a trust perhaps from a community, tapping the community to try and improve a health outcome. And these 52 different barbershops randomized to two different arms, one with medicines, bread and butter medicines, the other one with medicines as well as, the first with coaching and the other one with medicines and coaching. The coaching not delivered by people like me, but by the barber. Trained, but by the barber. The medicines, bread and butter technologies. 6 months in, they had nearly a 30-point drop in systolic blood pressure, and 60% of the men who were in that study no longer hypertensive according to the latest guidelines that came out 2 years ago. So I think the concept of treating people the way they want to be treated, tapping the community to try and drive health outcomes, is something that I'm excited about. I think at Facebook it's one of our primary missions, which is to try and improve the outcomes of our communities. And designing for humans this way, where we can actually make a significant impact, matters a tremendous amount.
Do you think there was something to that too, in terms of like no one is like intimidated to go get to the barber? Like, was there something in terms of compliance or attendance?
This gets us to the next point.
I was just randomly curious.
Yeah, it's a fair question. I think one of the things that often happens in science, where these sorts of aha moments occur, is that they are based on the serendipity of the investigator, which means that it's not measured, you can't reproduce it, you can't generalize it, but the gestalt of the person was present. And I think one of the things that the digital health space potentially allows is understanding these things in a more reproducible principal component way that perhaps we can actually apply to other populations. So it's not just African Americans in Southern California, but perhaps the Vietnamese population in Austin, and so on and so forth.
Interesting. So when you think about challenges, like I think there are a lot of challenges in healthcare, as we're all aware, but what do you think some of the greatest ones are, maybe specifically as it results to technology in healthcare, that we'll be facing in this next decade?
There's a lot of great technology out there. There's not been a great number of outcomes improvements from it. And so I think there's a huge gap, whether it's in a wearable space or otherwise, that tech is present, but hasn't demonstrated mortality, morbidity improvements the way I would want if I'm prescribing it to my patients.
I want to go back to one thing that you said earlier. When you think about, so you had said earlier, it doesn't matter about tech. It matters whether or not it's the right tech or the most relevant. When you think about that in the context of Facebook and our ability to reach so many people worldwide, is there any specific area that you think we have a greater ability to have impact on because of our reach, broadly, or even in terms of anything more specifically that comes to mind?
Yeah, we definitely try to use that to our advantage and try to improve outcomes through preventive health because of the reach that we have into folks, into our trusted network, et cetera. I think we've done this as well. Generally, people have come to Facebook to do things that are health-related, if you will. People in India, for example, were looking for blood on Facebook through posts, et cetera. And so we built a tool to help them connect better through this blood donations tool that's been out for a number of years. I think using our infrastructure and our reach to be able to help folks achieve their goals, enable them, whatever that technology may be, which improves outcomes, in this case blood donations, is such a powerful thing, as opposed to building a widget and hoping it works.
Yeah, that one launched just in the US in July, I think.
That's right.
So I want to wrap with what's a tradition at Facebook. It's called we call it Rapid Fire. But I don't know if you know this, maybe it's a tradition only in the Global Marketing Solutions group, but essentially I'm going to ask a question and you're going to answer it one or the other.
Okay.
But thank you so much for sharing all of that. I think one of the things that is not known about Facebook that we probably could do a better job of getting out there is that we really are investing in health outcomes and creating these solutions, and sometimes it's just bringing information to our users, and in other cases, it's as much as you mentioned, the blood donor tool. And so I really appreciate you coming on stage here with me to share. Yeah. Okay, so rapid fire. First, Facebook or Instagram?
Facebook.
WhatsApp or Messenger?
Messenger domestically, WhatsApp internationally.
I think you have to pick one.
What? Okay, Messenger.
Superman or Batman?
Wonder Woman.
Good one. Love it. Star Wars or Star Trek?
Star Wars.
Absolutely. Beaches or mountains?
Mountains.
And finally, the most important question of the day, puppies or kittens?
Puppies by a long stretch.
Ah, those poor kitties. Except if you're on Instagram, cats of Instagram.
That's right.
All right, thanks again.